got into this to work with patients, get our hands on people and spend that quality time, not to, write a novel to Medicare.
And from the provider's perspective, it's like, is my eye on the clock or is my eye on the patient?
But in real time, if we had a system that could capture that or flag, those nuances can really make or break a lot of clinics. My philosophy is to create the best employee experience possible, because our employees, our clinicians, are the product. What tools, resources do our clinicians need? Are they heard, supported? Do they feel engaged? After that, get out of their way. Well, we've always done it this way, which is like the most dangerous thing you could say.
Let's turn this healthcare business back into a craft.
100%. We have to. That's why we got into it.
Welcome back to the Othello's Taking Back Healthcare podcast. Today we are joined by Michael Rando. Thank you for joining us.
Thanks, man. Yeah,
would just be great to hear in your own words, like your background, how you got here today, and kind of what's exciting you recently.
Yeah. So I'm a physical therapist by trade. My background has always been in kind of the healthcare sector. I graduated with my DPT in 2013 from the University of Dayton in Ohio. I originally wanted to be a fighter pilot for the Air Force, but I was an athlete when I was real young. I wrestled my entire life since I was tiny, and then my senior year of high school, I suffered a really serious neck injury, and through that injury, I had to go through about 3 or 4 months worth of physical therapy myself. And when you're 17 years old, your perspective is so small. So at that time, I wasn't just hurting physically, I was hurting mentally too. Again, perspective. But through, the physical therapy journey, 3 times a week, every single week for 3 or 4 months, I had a great young therapist. His name was Jason. He ended up becoming almost a mentor, of mine. And didn't just help me physically, helped me mentally too. And I was able to get back and had a really successful career and went on, wrestled in college too. And I kind of thought as I was going into college, it's kind of feels good to, what he did for me felt great. Boy, if I could do that for other people, that's got to be a great feeling too. So kind of how I got into physical therapy and just kind of parlayed that into the strive to, for continuous growth, and, one thing led to another, and here we are, on the business side of it.
That's really cool. And I mean, we'll be talking plenty about the business of healthcare today, but I feel like when it comes down to it, that's probably the ideal provider experience, right? It's like, not only am I providing good care, I now want this person or I've now inspired this person to become like me. And so, I'm kind of curious, from your experience in the last, decade plus, when we're looking at, the type of care that we're not able to provide because of all of these like admin burden, how have you been trying to solve it up until now?
It's a great question. And there's multiple parts to that answer. And, that problem, there's no clear cut one single solution, and it constantly is evolving. But there's a philosophical point, and then there's all kinds of micro, we can, that we can get into, all kinds of micro. But the bigger picture, is in healthcare, it's an industry that, on 2 sides you have, organizations trying to earn money and make profit, and they have margins and whatnot. And on the other side, you're dealing with human lives. And oftentimes those 2 sides of the equation clash consistently. If you're an organization, you're too far into the margin portion and trying to make a profit, more than likely you're going to suffer on this side. And just the inverse too, if you're focusing way too much, or can you focus too much on, providing good quality and high service and serving your patients? If that's the case, you're probably hurting, from a financial standpoint. So, the problems that we're facing today, and it's no secret, there's a ton of margin compression with reimbursement changes and cuts, inflation. It costs so much more now to employ people, bring them on. The recruiting, just from an operational standpoint, costs, so much more. So, but we also have an abundance of patients too, like an overabundance of patients, more patients than we've ever, truly had with the aging population of the baby boomers. So we have this influx where, we don't have enough staff. We're constantly chasing our tail, trying to recruit and retain, competing with each other. But then we also, have all of these patients that need all this care, and, who's paying for it too. And so again, you're dealing with profit margins, but human lives too. And we're at this, crossroad, or, knee deep in the crossroad where, boy, oh boy, a lot of organizations are making some really tough decisions or pulling levers that, are, the quality is being, tuned down, or you're burning out, employees or clinicians in some capacity. So it's a multifaceted, kind of question, but
right. And it also sounds like there's two types of human lives that we're looking at here, because it's not just the potentially lower quality of care being given to the patients, but also to your point of like retention of providers, they're probably getting burned out. And so like there's also from the administrative perspective, how are we doing best by these providers so that they can give that high quality care, right?
Yeah, absolutely. My job as the CEO of this company, my job is not, I'm not seeing patients anymore. My job is to, our philosophy, my philosophy is to, create the best employee experience possible, because our employees, our clinicians are the product, right? So, I'm not seeing patients anymore. My hands are not on the patients, but what I can do is, are we providing, the necessary resources, support, for our employees? Do they feel engaged and heard? Are they satisfied? Do they have the autonomy to think critically and think on their feet as well? Without some of those aspects, more than likely, yeah, you are being burned out in some capacity. So, how can we provide the best employee experience to retain our product and promote high quality? If you can do that, then you're not constantly chasing your tail of, that doom loop of, retention, and, people are leaving and you're trying to come back. You're trying to come back and, rehire, and it's this never ending vicious cycle.
It's actually interesting you talk about that employee happiness perspective. You're the first person in healthcare I've even heard frame it that way. And not to get too Silicon Valley, but the founder of Zappos, Tony Hsieh, he has a book called Delivering Happiness, where his ethos is exactly that. If we make the employees happy, naturally the product and the business will be healthy and successful.
100%. Yeah, that's my number one goal is, to wake up every day. What tools, resources do our clinicians need? Are they heard, supported? Do they feel engaged? After that, get out of their way. Get the hell out of their way and let the kids say, let them cook, let them do their job. Now, of course, you need guardrails and guidelines and whatnot and protocol. But boy, oh boy, if you can, not have to spend the time micromanaging and microing every single aspect of what they're doing. And it's really hard not to, because when companies start to feel that really tight, margin compression, they want to get their hands on even more. What a great opportunity to really look at your product and look at the process of how you're supporting your product. It's way easier said than done, because so many organizations are still operating as if it's 2005 or 2010, and their operations are so kind of stuck in the past and still expecting the same results. But we in healthcare in general, my gosh, not just therapy, but we are the industry that is most resistant to change, or one of. Why? Why are we the most resistant to change? Again, it goes back to, profit and trying to, maintain margin, but you're dealing with human lives. When you're dealing with human lives and providing care of those humans, it goes through so many layers of bureaucracy or, attorneys are involved, HR, quality and compliance. It's got to go through multiple layers of your corporate organization's structure. And then you got to roll it out to the field with your clinicians. Have they bought in? Are they drinking the Kool-Aid you're trying to sell? And then you're rolling it out to the patients and trying to do that on the fly. It's tough. It's really hard. And by the time you get to that point, the environment's already changed. And now you got to go back to this. Yeah. So because there's so many layers, because you're dealing with humans and, the healthcare aspect, we are wildly resistant to change. All the time. It's, well, we've always done it this way, which is like the most dangerous thing you could say.
But I can also understand from the operator's perspective, because they're like, there's already so many problems. We're already chasing our tail. Why make it even more like of an existential crisis? But in the topic of how we focus on employee happiness, I'm curious. Let's say we take over a new PT clinic, and it's got the standard, fire alarms that people are chasing their tail, people are burned out, but we're focusing on employee happiness. Tactically, strategically, like what do you do? What are some of the first steps that you take?
The first step is always you're looking at your mission and your vision for the organization. Is everyone on board, in line, rowing in the same direction? More often than not, there's such a massive misperception or miscommunication from what the leader is perceiving is one thing and what the clinician is perceiving. And so when you do have to adapt and change or new policy or new system or whatever it is, because the environment changes constantly. If there is this gap and we're not all aligned and communicating effectively, it doesn't matter what you roll out or what you try to change or what lever you're trying to pull in the name of better quality or profit. Doesn't matter. Everyone has to be on board. So your culture and your mission and how you communicate these things has to be wildly, clear and critical. Way easier said than done. But first things first is making sure you have that transparent, constant communication. Leadership all the way through, down to the lowest level of the organization. I start there always. And then you kind of work your way up, get in and, speak with your employees at every single level and hear, their ideas, their insight, talk, communicate, take notes, and then really truly follow up. A lot of policies and systems are implemented and they're not the most popular, but they're necessary. Mm-hmm. Do they understand why they're necessary?
Right.
Are they misperceiving that, well, it's just because, the corporate or, the leaders, they just want to make more money?
Yeah.
No, not at all. I mean, that's certainly a goal, but a lot of times it's necessary because, CMS had made this policy change or this rule. You have to do some of these things, but do they understand the how and the why?
Right. So it sounds like at a high level, make sure everyone's on the same page about like the direction, which I would imagine, I don't know, you're probably doing like an all hands talking to everyone in the same room. And then after that, like at each level, meeting with people individually, hearing from their perspective, and then having like periodic follow-ups where you're like, one, how do you feel about the direction? And two, do you have feedback to kind of like
that constant feedback loop? Yeah, absolutely. Super important. It's so much easier if you have an organization, which is, our culture is phenomenal. Our organization. I came into this company a year and a half ago as the CEO. The company's been around for almost 36 years. When I took over, our retention rate, our turnover rate was less than 3%. And so right then and there, that one statistic told me a heck of a lot about the culture of the organization. The people, the employees truly believe and they like working for this organization. Once you've established that and you have that good culture and the buy-in and the mission and vision are really clear, implementing policy and change and providing feedback to and receiving feedback is so much easier because they believe in what we're doing. And it's so important. We can't lose that. Once that starts to go and we start to have that, we fall into that doom loop of, people are leaving. There's a lot of turnover. You're trying to hire and you're sourcing, recruiting, marketing. All of that time and resources is spent doing that, as opposed to the time and resources spent, taking care of the actual product type thing.
Right. So when folks are typically talking about, when they come in and they need to identify what to fix, they'll look at it from the perspective of finance, right? Where's the revenue leakage? When we're talking about, getting buy-in from employees, making sure that we're delivering employee happiness. So first, we're getting everyone on the same page. What are we doing next?
It's always so important to take a look at our own processes and procedures. The talent and the product, are, I don't want to say is the same. The therapist 20, 25, 30 years ago, pretty much the same therapist. Now they've had a little bit more schooling and, their clinical skills have maybe changed or adapted a little bit more. But it's our processes as an organization constantly have to be able to pivot and adapt to whatever environment we're in. So, that constant evaluation in ourselves of not molding the employee to the system, but kind of molding and fitting the system around the employee and that product.
It's like, here's some general parameters, figure out how you can play inside of that.
Correct. Yeah. So, what can we do to enhance general efficiencies? Where are some of the gaps? So it's always evaluating, if this one particular clinic or facility is losing X, but there's another 5 that are, earning Y, well, let's take a look and where are these gaps? And usually, there's something you can uncover by looking at the data and looking at the metrics and pulling reports and talking and kind of uncovering. So it's going through with a fine-tooth comb, but really having good awareness as an organization. Is this a process issue? Or is there a lapse in training, onboarding that we missed, and this particular clinic or person is not, on the right path in some capacity? Constantly having the finger on the pulse in that sense.
Right. So in your time so far, as you've been looking at processes to change, are there any notable big wins or case studies of?
Yeah. When I took over at this organization, the culture was phenomenal. The foundation was great, but it was not, still was operating like it was 2005, 2010, something like that. So how we scheduled a lot of the infrastructure was not updated, modernized, and kind of built out. So that was a big, those were big lifts, just the updating and policies, procedures, systems, and whatnot, implementing those. But again, the foundation was there. We had the culture. Aligning everyone on the same mission and vision was a heck of a lot easier because they already believed in what we were trying to do. Right.
Just any particular wins in changing those processes?
Yeah. So we implemented a new scheduling, an electronic scheduling platform. Prior to myself, it was all done by hand and text message, where 1 or 2 individuals, they had a big map essentially, and they knew this person could go here and see this many patients, and it was all over the place and really inefficient. Tons of time and resources spent on that. So we brought in a electronic scheduling platform that should be having AI capabilities here soon that can assist with some of those things, and it cut down on that efficiency time, almost immediately. Integration of that system was a bit of a trick because the organization has always done it, for the last 34 years this way. Now we're shifting in this direction. So, we kind of put our toe in the water and we did some beta testing at a few sites, and, we did a lot of back and forth and feedback and really valuing and listening to the clinicians, when they did give us some constructive feedback and criticism, really bringing it back to, the scheduling company that was working with us and making sure we really refine the product, and then we roll it out. guys, you're not losing this. We're not taking this and this away, but we're gaining X, Y, and Z, and having that communication. This is why we're doing this. We can't scale using this really inefficient system. So this is a pathway forward that's, eventually it's going to really improve some of the efficiencies. And now we see the fruits of that labor, and it really has. That was a big one.
As far as the front office, using this new AI scheduling software, a lot of the times when there is inertia in implementing that because it is new, what I've seen a lot of folks say is, well, listen, it's in addition to the efficiencies we're going to get from it, it's also going to allow you to focus on things that matter more, right? So it's like you can focus on things that matter more strategically instead of chasing your tail, being stuck in these mundane tasks. What are other areas that you're looking into right now where you want to see more of those efficiencies?
Definitely. It's, if we can relieve some of the administrative burden, both with, your front office staff, of course, but also from a clinical aspect, we as therapists, as a fellow therapist, we got into this to work with patients, get our hands on people and spend that quality time. Not to, write a novel to Medicare or, justify why we need this many visits or not, and spend all this time documenting and then having it scrutinized and micromanaged in some capacity or denied, whatever the case may be. I'm not saying it's not important. It's wildly important to justify, the need for our services. But, is there a way, such as like the integration of some AI systems, to more accurately capture that data, utilize it so we can, the clinicians can spend a heck of a lot more time doing what they love, doing what they set out to do? Could they also see more patients? If we didn't, if our clinicians didn't have to spend an hour and a half, 2 hours at the end of the day strictly focused on their documentation or, going back and fixing X, Y, and Z because of this, audit or whatever it is, could they see, a patient or two more? Well, probably, absolutely. I know I would be willing to see an extra patient if I didn't have to document for another, hour and a half, 2 hours. That's an easy win. So there it increases our, efficiency and productivity. Could it be more accurate? Absolutely. We're just scratching the surface of AI capabilities right now.
Yeah.
It's going to, like, how much it's changed in the last couple of years is, mind blowing. And I've sat in front of, probably a half dozen companies looking at demonstrations, and the demonstrations a few years ago to now are a lot different. So I have no doubt, what's going to be rolled out in the next 5, 10, 15 years is going to, change how we are operating and kind of working. But it's not there yet. And again, healthcare is so slow to adapt or so slow to implement change. Again, you're dealing with human lives, and before you implement something, it's got to go through hundreds of layers of all kinds of stuff. But we're not there yet, because most of the time I felt like when we started down these paths and we've done some demonstrations or some beta testing, you add, this particular system, AI system, but it also, there's another, you got to have this website open. You have to make sure, your phone is up with the app and it's recording, or your laptop and, this browser, that's an extra username and password. And you have to make sure it's all lined up and then synchronized. And then you get to the patient and everything's ready to go, and, the patient's not there, or they're in the bathroom. Well, then you got to hit pause. No big deal. Or what if the patient has, I've ran into this before myself, the patient has dementia. So they can't sign, the waiver program, or the waiver form for us to utilize, a recording device and whatever. That's, the attorney wanted that and HR wanted that before we could do it. So now I got to get the caregiver on the phone, the daughter, she's working full time. I can't contact her. So, well, shoot, now I can't use it for this particular patient. So when that happens once or twice to a clinician, they always go back, path of least resistance. And you know what? the hell with this. I'm just going to go and I can't do this. It didn't work out. The one time I tried it, Mrs. Smith was, in the bathroom, or this one had dementia. So when it works and works perfectly, in my experience, it's phenomenal. But if some of these variables where it's not there yet to be able to pivot and, be utilized in every single circumstance or situation, once it gets to that point and we're not, it doesn't add more steps and task, then that's where we need to be. We're not there yet,
Right.
but we're getting a heck of a lot closer.
Yeah, that makes sense. Because, I mean, when we're thinking about an encounter, we think about the specific, 45-minute appointment or something it is. But, in that perspective, you need to be making sure that you're getting those permissions well in advance, maybe same time you're running eligibility, whatever it is. But either way, to your point, when, if it is working perfectly, I'm certain that it's delivering on that employee happiness. Because, I know, like, I work in sales. So like, my day is just being, on calls. And then at the end of it, sometimes I'm like, I don't want to do anything. I'm like tired. God forbid a provider has to do 2, 3, 4 hours of notes. I'm sure you'd rather watch, Breaking Bad or something.
Yeah, no, absolutely. It's the least fun part of the job is, the paperwork and the documentation items, during and afterwards. And it's only gotten worse. I mean, way, way worse. And the amount of, audits and denials, again, I'm not saying, like, we definitely have to document what we're doing for sure. And it definitely needs to be justified. But holy cow, like, take, for example, like the infiltration of Medicare Advantage plans now in the United States. So we're predominantly in Minnesota. The state of Minnesota has the second most Medicare Advantage plan infiltration. Well, they pay a lot less, and they require so much more, justification, documentation than, and basically any other, kind of insurance company, Medicare. In doing that, it increases all kinds of cost and administrative burden. It's this trickle down effect. There's got to be some better ways. And can we leverage some of the technology to assist with that? That is a big threat right now that we're all trying to face.
Yeah, because it's the weird, I don't know, oxymoron of like, listen, we're a business, but we're putting ourselves in the way of doing a lot of work for little to no reimbursement, but then it ethically does not align because we need to be providing care regardless. But I have heard of some organizations and practices where they just go, we're just not going to serve them because it doesn't make any sense.
100%. More and more are doing just that, and they're pushing back for sure. We're not at that. Luckily, we're not at that space right now. But it is costing a lot more. If we have to bring in, like in Minnesota, we have this dense population in and around the city of Minneapolis, but then we serve all of these rural communities that are way, way out. Kind of, they're far enough away that it's not a seamless process to run operations because they're moving staff from point A to B in the city in like a 20-mile radius, a heck of a lot easier. But when we're serving this facility that's 3 hours away, that's a heck of a lot harder to get staff coverage. Or so if, in many rural communities, the Medicare Advantage infiltration is a heck of a lot higher. So that means, instead of every 10 visits or every so often, we have to get, a registered physical therapist to go and see this person. Can we use telehealth and leverage some other technology to assist with that? Yes. Yes, no. Sometimes it kind of depends. But it just requires so much more, operational nuance, and it's costing us more. It's costing the facilities more. It's costing, the patients because they're being cut off a heck of a lot sooner. The denials and whatnot. If, let's say, for example, and this is an important point, someone has, like Mrs. Smith, she has a Medicare Advantage plan. She's admitted to the facility, and with that, Medicare Advantage says, Mrs. Smith, you have 9 days here. We approve 9 days. After that, you put an appeal, and we'll see if we authorize an additional. So we go through. Mrs. Smith is getting a heck of a lot better. 9 days comes, but me as the physical therapist, say she needs 10 more or another 9 days, whatever it is. Maybe the Advantage plan or whoever doesn't get back with us, for 2 or 3 days. Well, in that 2 or 3 day gap, we can't see her during that time. Or we can see her, but then we risk, Medicare not paying us for that. So it's kind of what do we do? What do we do during that time? So we were just saying, Mrs. Smith is the most important thing. We're going to keep seeing her, and we're going to bank on, our ability to document and justify the need. But more often than not, they were being denied, or it was being, pushed back even further. So, then there comes a point where, well, let's just see him minimally or not see him at all. And so then Mrs. Smith declines over those 2 or 3 days. And then she's rehospitalized because she's declined, or they finally approve it, but it's 3 days later. But now we're back to baseline because she's laid there the whole time. Or then she's rehospitalized and we start all over. And then here we go again. It's just this constant doom loop cycle. Or the discharge from the facility way too early. They only get 9 days. So, okay, go home. Well, they go home, and here comes Mrs. Smith again a month later because she's rehospitalized. So then it's costing, 2 or 3 times as much, as opposed to, doing the thing that is maybe best for the patient.
Yeah.
That's we see this constantly, especially in the rural communities.
Yeah, and it's the vicious cycle of the price of poverty, which is like, something that could just be, let's just say for the sake of argument, $100 shoe once versus you have to buy a cheap $20 shoe because that's all you can afford, but you're buying it year after year after year, and Mrs. Smith is just never going to get better. And it's easy to put ourselves in her shoes and just go, I just want to be back to normal. Why is that so hard?
Yep, 100%. And, a lot of the frustration gets put on, the facility, the physicians, the therapist, because, well, you're kicking us out because of, you just want to, hedge your losses or, make more money, or you're doing all these things. And, oh my gosh, no, it's, we truly want, our goal is to provide, the highest quality of care. But if we're handcuffed by, programs and the integration of, or the implementation and infiltration of all these Medicare Advantage plans, it just gets harder and harder. Margin compression shortens, and then, organizations are forced to pull on the levers that are path of least resistance, which are, well, you're going to have to see, sorry, you can't just see 8 patients today. You're going to have to see 12, and then 12 becomes 14, and then 14 becomes 16, and you're doing group therapy, or everyone gets, 15-minute sessions as opposed to 45 or 60-minute sessions. And it's just kind of spirals in, unfortunately, kind of out of control. But it's critically important that, organizations that have fallen into that kind of doom loop trap, it always kind of revert back to, let's look at your organization and the foundation, your mission, your vision, of course. Do you have the culture and the buy-in? Are you constantly, it's a revolving door in your organization. Again, easier said than done. But it's this, it's a real problem, especially in Minnesota, for sure, the Advantage plans and whatnot. But just one of these things that, we have to adapt and be mobile and be able to pivot, and the organizations that do and can adapt to change in the changing environment, and having a good belief system throughout, they're able to adapt to these changes.
So, the last 3 years in particular with all this AI, LLM stuff coming out, obviously really exciting, and there's a lot of opportunity. In addition to some of, you just adopted this like scheduling software, what else kind of has your eye right now of areas of opportunity?
Yeah. So, integration of documentation systems for healthcare companies, clinicians. So improving some of those efficiencies, right? And catching some of those documentation errors or, improving some of the accuracy. But can we also tie that into, optimizing our billing or our reimbursement with that? So there is, I think, still a gap in one, how easy it is to integrate a system that accurately captures and, improves our documentation. But taking it to the next step is based on all of, this information that it just captured. Can it be translated into here's the optimal, CPT, the billing codes, for this, and flagging stuff for, for example, if, I'm seeing a Medicare Part B or a commercial payer, let's say a Medicare Part B patient, and I see a patient for 35 minutes, that is billed for 2 units. And so each unit, has a dollar amount to it. But if you see that patient for 3 more additional minutes, that's an extra unit of that. What we see a lot right now is clinicians falling back into how we used to operate back in 2005 and 10, how I've always done it is, well, everyone just gets, 30 minutes of care or whatnot. And, who cares? And it's all this and, again, path of least resistance, or they're copying, pasting, whatever it is. But can it flag to where, boy, if you just spent 3 more minutes with that particular patient, that's 1 more unit. Most of the time they are, but they're not accurately capturing, what they truly were doing and how they were doing it. We see that all the time, but that requires, some, human eyes and ears, like physically looking at this data and tracking it. And then we have to go back and educate and, next time you see this patient, maybe let's try this, this, and this, and we have to follow up on that.
And from the provider's perspective, it's like, is my eye on the clock or is my eye on the patient?
100%. Yeah. And you don't want to do that either. But in real time, if we had a system that could capture that or flag or somehow, Michael, you're at 36 minutes of care, are you, are you totally complete, or do you want to do an additional 5 or 10 minutes? And then you get one more, those little nuances can really, devil's in the details. Those nuances can really make or break a lot of clinics if you're not operating really efficiently like that and catching some of it.
Yeah, something we see a lot with PT billing is folks can oftentimes code at higher levels than they actually are. And then to your point, like, providers can only be experts in so many things, right? They're not going to be an expert in talking to insurance or tracking down a caregiver or knowing the exact right codes. I mean, some of these codes are ridiculous. It'll be like 53 minutes specifically. But then if the actual documentation isn't good enough, then it becomes hell for the back office where they go, how do we prove medical necessity? Or, this is saying the coding is wrong, so it's denied. If you have this perfect source of truth from the get-go, everything else is kind of smooth sailing.
Absolutely. Yep. It's being proactive instead of reactive, for sure. And are there tools and technology that can implement that? We do a ton of education on, the forefront of all of this. And it helps immensely. But we always see, every time we roll out and do some of these education pieces or initiatives, the curve, the improvement kind of goes up, and then a few months later, it kind of comes down or tails off a little bit. But to your point, yeah, absolutely. The back office folks, that requires manpower, it requires hours, and there's cost to that to fix things that should have been done correctly well in advance or way before that. What an area of opportunity for, to improve in some of these things. I again, AI we're close. I don't know that we're quite there yet, but that's an area, a lot of healthcare organizations, if they're not really looking at or taking it really seriously to integrate something like that, they're going to be left in the dust or continuously chasing their tail trying to fix some of the cost.
Yeah. And becoming at the whim of payers who are implementing the exact same tactics to deny them automatically.
Exactly. Yeah. Exactly. Yep, for sure. Yeah, the justification piece, and the accuracy, the efficiencies, super important.
Yeah.
Big time.
Yeah. So just to kind of round it out here, I'm curious if you have any words of wisdom or advice for folks who are looking to break into this space, because ideally we do, create new greener pastures so that folks moving forward have encounters like the ones you had back in high school. What are some kind of, how do you see the future of healthcare, and any words of wisdom to impart?
The personal experience of my own journey through physical therapy, and that was the first stop of many injuries through wrestling and having a lot of physical therapy. There is definitely a labor shortage with therapy, healthcare professionals in general, specifically in therapy. I went to school for 9 years. To tell a 18-year-old kid, the next 7 to 9 years of your life is going to be dedicated to this craft. But then they get out and it kind of looks like, you got to see 12, 15 patients in a day, and, your documentation, you got to do 2 hours of documentation and you're paid this. Healthcare and therapy in general, like therapy, PT, OT, and speech therapy services combined represent between 1% and 2% of total healthcare spending in the United States. Yet we are, almost thought of, almost as like an afterthought with our space in the healthcare sector. And I think if we're only representing, 1 or 2% of this total pie chart, we have to really start to look at how we operate, and we got to think outside the box. We can't, think think and operate like a massive pharmaceutical company, or continuously compete with each other for the table scraps that we have. It's definitely a systemic problem. The therapy world is very heavily based on preventative-based medicine, being proactive instead of reactive. But everything in healthcare is modeled around being reactive and fixing stuff downstream. So if I am, a lawmaker perhaps, and we have this, health crisis and all these abundance of patients that need all this chronic care, investing in stuff that helps downstream and being reactive, or investing and, cultivating a workforce and environment that is upstream to prevent some of these things. You imagine the cost savings if we can prevent Mrs. Smith from falling and breaking her hip and contracting pneumonia and falling into that doom loop kind of cycle. That is a massive undertaking. We're newer as a profession, but the advocacy, the lawmaking around this policy, we have to be better advocates for ourselves and put us at the forefront in healthcare, as opposed to just kind of being an afterthought, or, I guess you need it or you don't. What can we truly do? And bringing some of the metrics and the data to the forefront. We're also, this coincides with how therapy just in general is reimbursed as well. And again, we're always, for the most part, downstream, at the lower end of, the process of healthcare. Well, what if it was kind of shifted and we were at the forefront of a lot of these diagnoses and the problems, so it doesn't end up down, the path where we're trying to pull ourselves out of this vicious cycle that so many organizations and patients and have kind of fallen into.
Right. And at the start of that, you specifically said you got into this craft. And so I think if I had to sum up what sounds like your mission is, let's turn this healthcare business back into a craft.
100%. Yeah. Yeah, we have to. That's why we got into it. That's why all the therapists get into this. And that's the challenge moving forward.
Well, we're here to help.
Yeah, man.
Michael Rando, thank you so much for being here today.
Yeah, thank you. Appreciate you guys. Thank you.